Okay, Paul, we're now live. You can go ahead.
Good afternoon. Thank you all for joining us today. I'm Paul Gullickson, Communications Manager for the County of Sonoma, and this is our COVID-19 update for Wednesday, January 5th, our first update of the new year. Let's begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas tardes y bienvenidos a la sesión informativa. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Y ahora regresamos para atrás con Paul Gullickson.
Thank you, Gilbert. And once again, Happy New Year to you all. As we turn the calendar to 2022, we begin what is the third year of addressing a pandemic that continues to impact us in many ways, from work to school to our family life. Unfortunately, as we were a year ago, we are currently in the middle of a surge here in Sonoma County, as well as all across the country. Our cases in Sonoma County have nearly tripled in the past few weeks, as has our positivity rate. In early December, we were averaging less than 40 cases a day. Now we're seeing 200 to 300 per day. And we'll be taking a closer look at these numbers and where they're trending in a few minutes. Fortunately, though, we have learned many lessons in the past 2 years that have prepared us to adapt and mitigate COVID and surges like this. We know that first and foremost, that the best tools that we have for addressing this pandemic are vaccinations. And then we continue to encourage everyone to get their booster shots as soon as possible. And if they haven't gotten their full vaccinations, to get their first and second doses and start there. Thankfully, we have now vaccinated more than 3 out of every 4 county residents. And we believe that's helping. Our hospitalizations are nowhere near the level they were a year ago, as well as during the Delta surge over the summer. We believe this is further evidence that the Omicron variant, while highly contagious, is not as virulent as other forms of this virus. We are just not seeing the negative outcomes that we once did, which is encouraging, but we still have a long way to go. We are not seeing as many COVID patients in intensive care units, and COVID deaths are rare. Although we did have 1 more death to report today. This was an individual, a man over the age of 60, who passed away on December 17th in a hospital. This individual was unvaccinated and had underlying health conditions. So this brings our total death count in Sonoma County so far due to COVID to 419. So even though we're not seeing as many hospitalizations, our hospitals and clinics are struggling with staff shortages due to illness or the need to follow COVID protocols due to staff testing positive. So we really are encouraging everyone to help prevent the spread of COVID in our community by wearing their masks, getting their boosters, and if they haven't as yet, get their first and second rounds of vaccination. So for more on the current state of the pandemic, as well as recent changes in our health orders and guidance, let's go to Sonoma County's Health Officer, Dr. Sundari Mase. Dr. Mase?
Great, thank you so much, Paul, and Happy New Year to everyone. Now I'm going to give you the update on where we are. We have been preparing for the next wave of the pandemic due to the Omicron variant, and now it is upon us. As of today, our case rate has risen to 56 cases per day per 100,000 residents, and our testing positivity rate is 13.7%. Let's look at how that compares to other phases of the pandemic. At the height of the Delta surge, our case rate was 34 per day per 100,000 and testing positivity was 8.3%. During last winter's surge, our case rate reached 54 per day per 100,000 and our testing positivity topped out at 9.6%. Now we are likely not yet at the peak of the Omicron surge. We do expect our case rate to continue to climb, especially since we know the cases tend to spike 1 to 2 weeks after every major holiday as people gather and spread the virus. And Omicron is much more transmissible. So we would expect to see an increase in cases. Indications from other countries that detected their Omicron variant before it arrived here are that we could see the peak probably by mid to late January, and we'll be on the back end of this surge soon. Looking more closely at our hospitalization rate shows why this surge may be less severe. There are currently 34 people hospitalized with COVID, compared with 84 at the height of the Delta surge and 104 last January. Only 6 patients are currently in the ICU with COVID, compared to 24 last summer during the Delta surge and 26 last winter. Our high vaccination rate is also an important reason why outcomes are not as bad as in other stages of the pandemic. Comparing our vaccinated and unvaccinated population shows that unvaccinated people are 4 times more likely to be infected with COVID, 17 times more likely to be hospitalized, and 14 times more likely to die of COVID. With many people testing positive these days, there is some confusion about what to do if you've contracted COVID. If you test positive, the first thing you should do is isolate yourself for at least 5 days. Get a test on day 5, and if it is negative, you can end your isolation. If you can't get tested, you can end your isolation after 10 days if you don't have symptoms. If you used an at-home test, you should report these results to County Health at 707-565-4667. Again, that's 707-565-4667. Notify close contacts if they've been exposed. A close contact is someone who spent at least 15 minutes over a 24-hour period within 6 feet of a person who tested positive for COVID. People who are fully vaccinated do not need to quarantine after contact with someone who had COVID-19 unless they have symptoms. However, fully vaccinated people should get tested 5 to 7 days after their exposure, even if they don't have symptoms, and wear a mask indoors in public for 14 days following exposure or until their test result is negative. Now, if you are symptomatic after contact with someone, regardless of whether you're vaccinated or not, you should get tested and isolate. Unvaccinated people should, if you're a contact to somebody with COVID, should stay home for 14 days after your last contact with a person who has COVID-19. If you have symptoms, immediately self-isolate and contact your healthcare provider. There have been several changes to health guidelines recently, so let's look at the most up-to-date guidance. First, masks are required in all indoor public settings, regardless of vaccination status. There is no more exemption to the mask requirement for stable cohorts of vaccinated individuals. So even if you're in a fully vaccinated group that meets regularly indoors, you need to wear a mask at this time. Wearing an approved face covering like a well-fitting surgical or N95 mask remains one of the easiest ways to prevent the spread of the virus. Cloth masks are not as protective as surgical masks and are not recommended. The Centers for Disease Control and Prevention also updated the quarantine and isolation guidelines, shortening the time from 10 to 5 days. And lastly, I issued health orders last month requiring certain frontline workers, including fire, law enforcement, EMS, and school employees, to get booster shots or submit to regular testing at least 2 times a week. Getting fully vaccinated and getting booster shots, if you're eligible, continues to be our best tool in controlling the pandemic. This is evident from the fact that unvaccinated individuals experience much worse outcomes from COVID than vaccinated individuals. So getting vaccinated, getting up to date with your booster shot, if eligible, may not protect you completely from getting COVID, but it definitely will keep you from getting really sick, getting hospitalized, and having very bad outcomes such as death. For more on our vaccination campaign now, I'm going to turn it over to Dr. Urmila Shende, our vaccination chief.
Thank you, Dr. Mace. We continue to outpace much of the state in getting people vaccinated. Sonoma County has the 9th highest vaccination rate of the 58 California counties. We've now administered more than 900,000 vaccinations, and 77% of the eligible 5 and older population is now fully vaccinated. with another 8% who are partially vaccinated. Our school-based pediatric vaccine clinics resumed this week after taking a break for the winter holidays. School clinics will be held on Thursday at John Reed Elementary School in Rohnert Park, Madrone Elementary School in in Santa Rosa, and Guerneville Elementary School in Guerneville. On Friday, there will be a clinic at Abraham Lincoln School in Santa Rosa. Our 5 to 11 population is now 22% fully vaccinated, with another 15% who are partially vaccinated. So we're well along on our goal of getting 50% of this population vaccinated by the end of January. On the booster front, we've administered more than 160,000 booster shots to eligible residents 16 and older, providing important protection against the highly contagious Omicron variant. Federal regulators are on the verge of lowering the booster eligibility to anyone 12 and older. The CDC this week could approve the Pfizer booster for 12 to 15-year-olds if they are 5 months past their second dose. ACIP, the advisory group to the CDC, is meeting today to finalize this recommendation as well. They will also likely advise that Pfizer boosters may be given 5 months after the primary series is completed. Once we have confirmation of this, we will notify all vaccine providers in the county of this update. There will be more to come on this in the next few days. In addition to requirements that healthcare workers get vaccinated, the California Department of Public Health this week issued a health order requiring all visitors to hospitals, skilled nursing facilities, and residential care facilities to show proof of full vaccination and a booster dose if eligible, or show proof of a negative COVID test. Besides vaccines, testing remains a critical piece of our COVID response strategy. As students return to school from winter break, it's important that they aren't going back into classrooms with COVID. Testing is the best way to know your COVID status. Even if you are asymptomatic, if you think you've been exposed to someone with a positive case, or you've been traveling or gathering, please get tested before going back to school or work or any place where you can expose others. You can find information about testing opportunities at socoemergency.org/test. For local vaccine clinics and how to make an appointment, please visit socoemergency.org/vaccine. I look forward to answering your questions, but first I'll turn it over to Kate Pack, our lead epidemiologist, for an update. Kate?
Okay, thank you, Dr. Shande. I'm just going to share my screen. Okay, so these charts are looking from January 2021 to the present. And our metrics as of today, we are at about 56 new cases per 100,000 residents per day. And our test positivity, you can see here, has also increased quite a bit and is now at almost 14%. And we have surpassed the test positivity, the peak of our test positivity at any prior point during the pandemic. Our prior highest test positivity had been 9.6%. In the lowest healthy places index quartile, these are the areas of the community where residents have less access to resources to support their health and well-being. Test positivity is now at 14.1%. And this is almost to the height that was reached in winter 2021 of 15%. And we've seen these increases over a very short period of time. So just 14 days ago, we had a case rate of 14 new cases per 100,000 per day. So you can see it's been a very steep increase that we've observed after the introduction of Omicron in the community. Currently, our hospitalizations are at 34 individuals hospitalized with COVID-19. And as of today, 99 people have passed away from COVID-19 complications. And I did want to note with regard to hospitalizations, well, we do have relatively low hospitalizations at this time as compared to our current case rate. hospitalizations tend to lag, increases in hospitalizations tend to lag behind increases in community transmission. And because we've seen such a rapid increase in transmission, it still may be a bit of time before we see that reflected in our hospitalizations. Typically about 2 to 3 weeks after we see an increase in our community transmission, we begin to see increases in our COVID-19 hospitalizations. Looking at our case rate by vaccination status, among the unvaccinated population, we currently have a rate of 114 new cases per 100,000 per day, as compared to about 28 new cases per 100,000 per day among the fully vaccinated population. Looking by racial or ethnic group, we have seen an increase in the case rate among the African-American population in Sonoma County that began in December and has remained elevated. Case rates are currently highest among Black African-American residents, followed by Pacific Islander residents. You can see here individually for each race and ethnicity, and then here together. Followed by American Indian, Alaskan Native residents. And these case rates are impacted by the size of each population in our community. So it's looking at the proportional impact of COVID-19 on each racial ethnic group. So looking at a rate per 100,000, we see the highest rates among Black African American. Looking at our testing is currently high. And this is just looking at PCR tests. So we're currently conducting 672 tests per 100,000 residents per day. And we've seen an increase recently over the past couple weeks. And we have also seen increases in the use of antigen tests as well. Looking at source of infection, this chart is showing the proportion of cases with known source of infection that are due to gatherings, whether those are large gatherings with more than 12 individuals or small gatherings with less than 12 individuals. And looking over the course of the pandemic, we see that we currently have the highest proportion of cases due to gatherings at any point in the pandemic, with about 50% of cases with known source of transmission due to gatherings. And these have been related to things such as office holiday parties, friend and family holiday gatherings. Other significant sources of transmission that we've seen have included household transmission, community exposure, and travel. Looking at Sonoma County's increase in case rates as compared to what we're seeing regionally and across the state, you can see that we are following the same pattern. Sonoma County is shown here in green, the Bay Area in orange, and California in blue. And CDPH has stated that the Omicron variant is now the dominant strain of variant in California. In Sonoma County, so far we have sequenced 59 Omicron cases, but there is a lag in that process, and we expect that we have many more Omicron cases than those that have been sequenced. Okay, and this slide is looking at a trend that we have seen recently since we first detected Omicron in Sonoma County, and that we have had an increase in post-vaccination infections. And this is consistent with research that is shown with the Omicron variant that individuals who are fully vaccinated, but it's been 6 months or more since their second dose, that they have immunity that is their immunity is decreased against the Omicron variant. And that's why it's particularly important for individuals who are eligible to get boosters. And while we saw that case rates remain highest among the unvaccinated with a rate of 114 new cases per 100,000 per day, we are also seeing outbreaks among the fully vaccinated at this time. One example we saw recently was during an unmasked holiday dinner among fully vaccinated attendees, over half of the individuals tested positive. And among samples from that outbreak, we did find the Omicron variant to be present. It's important to note that although we are seeing vaccine breakthroughs, looking at our data in the county, and this is updated daily, when we look at relative risk between unvaccinated and fully vaccinated community members, we find that people who are unvaccinated are still 4 times more likely to be infected with COVID-19, 17.1 times more likely to be hospitalized, and 14.1 times more likely to die of COVID-19 related illnesses. And the modeling that the state has released really emphasizes the importance of being vaccinated and staying fully updated on your vaccines by receiving a booster dose in order to decrease the risk of serious illness and hospitalization. So in these models, this is showing how boosters may be a key factor in preventing hospital capacity issues this winter. So in this first scenario, in which 66% of our eligible population 16 plus would be boosted by March. This is modeling that suggests that over 300 hospitalizations could occur during the surge. With more individuals boosted, this is lower. And then here in the third scenario with 95% boosted, we see hospitalizations below the peak. In this line, this dotted line is showing our peak hospitalizations during our last winter surge. So of course, this is modeling that has there's always errors involved in modeling. So this is just different possible scenarios, but it does suggest that getting boosted and staying fully vaccinated, fully updated on your vaccinations could be a key factor in preventing hospital capacity issues this winter. Looking at our current booster dose administration, we have almost 53% of our currently eligible 16-plus-year-olds in the county with their booster dose, with 65% of eligible adults over the age of 50 with their booster dose. And looking here by Healthy Places Index quartile, we can see that there is some disparity with 45% of those eligible in the first quartile with their booster dose as compared to 60% in the highest quartile. Looking by race ethnicity, we also see disparities with a little over 60%, for example, of white non-Hispanic residents boosted as compared to 34% of individuals in the Latinx population. Looking at our vaccine administration overall, we can see that 77% of the population 5+ is now fully vaccinated, with another 8% partially vaccinated. Looking by age group, we can see that the proportion of residents fully vaccinated by age group ranges from 22% in our 5 to 11-year-old age category to 93% among those age 70+. Looking closer at 5 to 11-year-old vaccine administration, we can see that by race ethnicity, the proportion of 5 to 11-year-olds with at least 1 dose, that there is some disparity by race ethnicity, with Black, African American children in the community with just about 24% boosted as compared to 58% of Native Hawaiian Pacific Islander residents. And here, looking at the proportion of doses being administered to each racial ethnic group as compared to the proportion of the population made up by each racial ethnic group, you can also see here an overrepresentation of doses going to the white non-Hispanic population here in the orange as compared to the proportion of the population, and the opposite when we look at Latinx. Looking at the proportion vaccinated within each race ethnicity overall in the population, we continue to see a smaller proportion of Latinx, American Indian, Alaskan Native, and multiracial residents age 5+ who are fully vaccinated as compared to residents of other racial ethnic groups. And looking at our vaccine equity metrics, we can see here in the lowest quartile of the Healthy Places Index that 25% of all doses have gone to residents in this quartile. And looking at the percent of the population fully vaccinated in that quartile, we can see that 70% is fully vaccinated, another 7% is partially vaccinated. And if we look at the fully vaccinated percentage here, we can see a gap of 9% between residents in the lowest quartile versus the highest quartile. And I'm going to turn it over to Dr. Mees to discuss this last slide.
Yeah, thank you so much, Kate, for the excellent presentation. First, I would like to just clarify some specifics on what to do in terms of quarantine if you're exposed to someone with COVID-19, because I think there was a little confusion there. So if you are fully updated in your vaccination, that means you are boosted if you're eligible for getting a booster, or you've had at least the first vaccine series if you're not yet booster eligible, and you know that you've been exposed to somebody with COVID, you would test on day 5, wear a well-fitting mask, and again, a surgical or N95 mask is preferable around others for 10 days, especially in indoor settings. And if you do test positive, then you would be a case of COVID and you would need to follow the isolation recommendations. And if any symptoms develop during any of this time, you would test and stay home. Now, if you are exposed and you're unvaccinated, or you're vaccinated with the first 2 doses, but you haven't had your booster yet and you're eligible, then you would stay home for at least 5 days after your last contact with a person who has COVID-19. Test on day 5. Quarantine at home can end after day 5 if you have no symptoms and your test is negative. Now, if you're unable to test or you don't want to test and you have no symptoms, then you would end your quarantine at day 10. Either way, you're going to be wearing a well-fitting mask around others. That is, if you're not quarantined and you're tested negative, still you'd wear a well-fitting mask around others for a total of 10 days, especially in indoor settings. And of course, if you test positive, then you're a case and you would follow the isolation recommendations. So I just wanted to make that really clear, and in case there were some confusion about that. Now, let me tell you what the response has been. There's a partial response in terms of state and local health orders for the Omicron variant. So the state put out an update to their mandates requiring booster doses when eligible for the following high-risk people: healthcare workers, especially in hospitals, any healthcare workers, adult care facilities, people providing direct care, care in correctional facilities, detention centers, that they must receive a booster by February 1st, 2022, or within 15 days after being eligible if they're not eligible by February 1st, and that they must test at least twice weekly until they are considered fully boosted, which is actually 14 days after getting the booster shot. That's a state order and it's a mandate. And the only people that would not have to fulfill this mandate who are in these groups are those that have a medical or religious exemption. Now, in the local order side, here at Sonoma County, we have extended or continued with our vaccine verification soft mandate to include boosters. Basically, for workers in schools that need to be vaccinated and when eligible, boosted also by February 1st. Otherwise, they need to also test at least twice weekly. Now, we have also recommended strongly that those who don't have boosters start testing twice weekly right away, even before February 1st. In addition, we have extended our vaccine verification order for fire, law, EMS providers, pharmacies, people working in pharmacies, dental offices, and temporary disaster shelters, also that they must be vaccinated and, if eligible, boosted by February 1st, or 15 days after they become eligible for boosting. Or again, they need to test at least twice weekly if they're not up to date on their vaccinations. Now, we've also requested that these groups start the twice weekly testing as soon as possible and not wait for February 1st in the light of our Omicron surge. I've also, as I mentioned in the talking earlier in my comments, that I have rescinded the face covering exemption for fully vaccinated stable cohorts. And lastly, we have a few recommendations. We do strongly recommend that all businesses, all employers require a booster of their employees who are eligible or have them test at least twice weekly. And in addition, we've also recommended that employers should consider requiring those who are unvaccinated or unboosted to, if they're eligible, that is, to wear a surgical mask or an N95, not a cloth facial covering, as it's clear that the cloth coverings are not as protective. So that would be the extent of my update, and I'll turn it over to Paul.
Thank you, Dr. Mason. Thank you for those clarifications. We really appreciate it. I also want to introduce Casey D'Angelo, one of our longtime friends and from the Sonoma County Office of Education. Casey, do you have an update for us on all you're doing to get kids ready to go back to school?
Yes, I do. We have several clinics going on this week, finishing up their second clinic that was started before winter break. And we also have several clinics starting next week, kind of our second wave of clinics. We'll have one at Rancho Cotati High School on Monday, January 11th. And we're really hoping we'll have a good turnout at all of those. We think that's important. Recently, the state has made the efforts to get a testing kit for antigen testing to every student in California. And so yesterday, Sonoma County Office of Education received 67,000 boxes of tests, 2 tests each. And today they're going out to schools and school districts. And these tests are meant to be screening tests to be used for students to see if they might be infected. And if not, then that's good information to know. And if they are, then they can isolate and quarantine as they need to be. But we haven't had access to those antigen tests before for all students. So we're happy that those are available.
Great. Thank you. Thank you, Casey. And thank you for being here today. We look forward to hearing more in the days to come. Well, we're going to end our session here. I just want to thank all of our panelists for sharing today. We presented a lot of information, so I want to remind you that this recording will be posted and available on the county's Facebook page, as well as on the county's YouTube page in Spanish. We also would like to thank the crew who helped us put this together, including Mari, our Spanish interpreter, and Elizabeth, our ASL interpreter. We will be streaming a version of this briefing in Spanish on our Facebook page tomorrow at 11 a.m. And we will have another COVID community update for you next week. So we hope you'll join us. Until then, stay safe, everybody.